Assalamu alaikum. Good evening, everyone out there. It's been a while since we spoke. I just wanted to give you some update that I have received, and I just wanted to give you some of the frequently asked questions that I have received, and I wanted to share that with you. For those of you out there who had some of these questions, and I want to clarify so that way you know what you're looking for and the correct response to your questions. The first question that I received was, how does the virus spread? What we know currently is that this is a virus that came from animal, and it is spread through respiratory wise, known as respiratory droplet. Uh, and we're still learning a lot more about it. Initially, if you had watched the news and followed up with CDC, even now they said to keep a 6 feet distance at least, so that way you don't catch that disease from the other person. Along with that, I think one of the most recent updates is saying that you should not be around a person more than 10 minutes. So 6 feet for 10 minutes. That's the most recent updated information that's been as of from CDC. The second question that I have here says, how do you test for a person for COVID-19? So as of now, if you have the symptoms, obviously you would need a prescription from your doctor to get tested. Depending on where you live, currently in Passaic County, we do have screening going on at William Patterson College, and that's usually done Monday through Saturday from 8 o'clock in the morning, and it can go up to like 2 o'clock in the afternoon. But again, it requires you to have a prescription from your doctor. So based on that, we will do they will do the swabbing. I myself have been there doing some of the screening with other staff. It takes about 2 days to get the results. If it's positive, you will receive a phone call, and if it's negative, it may take up to 5 days to get the result. It can also be that your result may come out negative, but you have symptoms. So there are a lot of false negative results. So if you do have the symptoms, follow the same. If you have the symptoms but your test is negative, you follow the same protocol. Isolate yourself from others, and let the virus take its course. And if your symptoms get worse, such as shortness of breath, difficulty breathing, and dry cough, and call your doctor. You're not currently they don't advise you to just go to the ER, because a lot of patients are positive, and you can actually may not be admitted, and you're going to be sent home. Again, depending on how symptomatic you are. The best thing to do would be call your primary physician, or what's recommended also is that telemedicine. So based on that, they'll give you advice in terms of how to take care of yourself. Okay. The next question that I have over here is, what are some of the symptoms and complications of COVID-19? So which I just had mentioned: shortness of breath, cough, difficulty breathing. These are some of the major signs. But there are a lot of people can also be asymptomatic, or as stated in the past, we're still learning. Some people may be a carrier and may not have symptoms, or have different symptoms. So we're still learning, and CDC will be the best place for you to follow up and what's happening currently and what are additional symptoms if there are any. The next question that I have is, how should I handle a suspected COVID-19 case? So again, if you have a family member that's have COVID-19, the best thing to do, as has been recommended by CDC, is to self-quarantine, or keep yourself away from everybody. I myself have been living away from family because I don't want to give anything to my loved ones. So that is recommended for you as well. Obviously, you may be in a different situation. You may not be a healthcare provider, and you're maybe a family member, whether elderly or young person. Whoever it is, keep a distance, keep an eye on them. give them all the support they need. Usually it is still treated symptomatically. That means if you have fever, they give you Tylenol. If you keep yourself hydrated, one of the things I have read and is that you don't give ibuprofen or Motrin for this disease. So other than that, a Tylenol is considered to be safe. A lot of times you hear on TV in terms of antibiotic chloroquine, and as of now, don't listen to the politicians. Listen to your medical advisors. Politicians, for whatever their reasons are, again, we don't know, but your medical provider would know the best treatment for you. Don't listen to your neighbors or others. Again, if you're doing some herbal supplement, things like that, again, it may not do any harm, but nonetheless, any kind of prescriptive medication, you want to not just jump into it, talk to your doctor, because some of these medications has a lot of side effects, including eye problem, heart problem, and other things. So just don't listen to somebody who's saying, well, this will help, and just check with your doctor. Okay. That's actually the next question that came. What is the treatment? What are the treatments? So as I said before, it's symptomatic treatment. If you have fever, you take Tylenol. If you have body ache, you can take Tylenol. If you drink lots of fluid, keep yourself hydrated. Keep away from everybody. Again, if you need to cough in your arms, don't spread any germs, and wear a mask. And if you're in a household, obviously, try to use separate bathroom from everybody else. And upon using it, clean it thoroughly, so that way germs is not spread to the next person. Okay. So the next question I have here is about travel. Is it safe to travel internationally? As you know, some of the countries have very high rates of COVID-19. So those areas are pretty much off limit currently. Some of these places are like China, Hong Kong, Italy, Iran, and South Korea. Those are some of the major hot zones. So other places, again, it's not currently. Personally, I would not feel comfortable traveling anywhere because, again, you're gonna going through a lot of channels, and the risk of you getting exposed to other people that are on the plane, or you having something passing on to somebody else. So if you can, try to avoid it. I mean, I know a lot of people canceling their vacations and family trips and things like that. Again, it's a precaution you want to take. You don't want to be in a situation where you don't have to be. I have a friend who just recently came from abroad. Now they're quarantined in their own house for 14 days. And there's no point in going somewhere and you're going to be quarantined. And I don't think you'll enjoy that travel. Okay. Here's the next one. It says, where can I get updated information for COVID-19 and our protocols? So again, this is an evolving process. As we can see, that we're learning more and more every day, every hour pretty much. And the best place, even though some things are outdated, but it does get updated on CDC website. So ideally, that's your best source of information where who you should listen to and how you should handle the situation. Okay. One of the other questions that came up here is it says COVID-19 situation is giving me anxiety. Where can I go for help? So again, you're not alone. There's a lot of people that are having anxiety and very stressed out being in the house. Pretty much it interrupts your routine, your family situation and all that. Ideally, there is, you can call hotline. Some of the, pretty much look at your local hospitals and local community. They should have some hotlines where you can call. My facility where I work, they actually have a hotline as well. And again, everybody's trying to help everybody in the community. And one of the greatest thing in this situation that outpour support for one another, whether you're a healthcare provider or mental health worker or social worker. People are out there trying to help each other. I know working in a hospital, we get a lot of food donations, and even sometimes masks and things are being donated. So again, for your anxiety and what have you, contact your local healthcare provider, and they will be able to give you some guidance in terms of what's out there available for you. Okay. Uh, those are some of the major questions that I frequently asked questions that I received. And as I go on further and I learn more, and whatever I am able to, I will next time give you more further update. Thank you for your time, and I look forward to talking to you again. And please stay safe, and as usual, keep your social distance and be safe. Assalamu alaikum.